Queue of cars outside a Beijing crematorium. Like many others in China, it is struggling to cope with an increase in deaths in recent days. Though there's no official acknowledgement the deaths are COVID-related, authorities admit it is now impossible to trace cases of the virus, 2 weeks after pandemic measures were relaxed. Beijing is laying on 1,200 new fever clinics in an effort to deal with the rise in cases as COVID spreads through a population with low prior infection rates and where many elderly still lack booster shots.
At present, the city's medicine supply and medical treatment resources are under increasing pressure due to the rapid spread of the epidemic and a continuously rising number of patients with fever. After some hard work, the supply and demand for medical care and drug is still carefully balanced, but we are on the way to stabilizing that.
In Wuhan, where the pandemic began, people are grateful to no longer have severe restrictions, though they remain cautious.
What I feel the most is that it's not that easy to buy medicine. My entire family have fallen ill and are trying to get better at home. But everyone's free to go outside now, which I think has made life easier.
I really wanted to go outside in the first week after many of the restrictions were dropped, and I want to travel immediately. But I decided to wait and see for a while to find out what's going on.
Having long vaunted the country's zero-COVID policy, Chinese state media has, since measures were relaxed, been relatively upbeat, carrying stories of the country and the economy getting back to normal. In some cases, this means working through COVID. Employees with mild symptoms in many companies have been asked to turn up for work, as have staff at Foxconn's production base in Zhengzhou, where the company is racing to meet demand for the new iPhone Pro 14.